Hey everybody, Mike here. Welcome back to the channel and welcome to a new video. Well, today we're going to be in the realm of first aid and medical care. And we're specifically going to be talking about anatomical directional terms. What does that mean anyway? Well, let's say you are taking care of a patient, but you are in a remote area and you need to talk to a doctor in a hospital that's miles away, and you need to talk the same language because you need to explain what type of wound is present and where it's located and so forth. Now, specifically, the where it's located, that's what we're talking about. How do you describe a location on the upper body on the right hand side, on the lower body on the left hand back side, and so forth? So these terms we're going to talk about, okay? And if nothing else, this video will help you to understand what they're talking about next time you're looking at Grey's Anatomy, right? Okay, cool. Let's start at the beginning. When you typically look at a patient and refer to a patient, you look at it, you look at the person from the front. So the person is standing, right? The head is straight, the eyes are looking straight at you, and the arms are next to the body, slightly removed from the torso, with the hand palms forward. Okay, that's important because if you have to explain a wound on the hand, you need to know whether it is on the front or on the back, and what front and back means. Okay. Now, let's start at the beginning. So, looking at a patient in that position, there is an imaginary line called the midline. It's a vertical line going from head to toe, and it kind of splits the body in half vertically, right? Now, anything that's closer to that line would be referred to as a medial, and anything further away would be referred to as lateral. Now, if you, for example, are referring to the right shoulder would be lateral to the sternum being the breastbone. But you can use that on whatever you want to describe further or closer to the midline. Okay, next up is superior compared to inferior. Now, superior being, I would say, typically anything above the belly button. So from the belly button moving up is superior, from the belly button moving down is inferior. Now, let's say you have, I don't know, a wound on your right knee. Then it would be a wound that is inferior to your pelvic bone, for example, or inferior to your chin, obviously, right? So that's how you indicate a position above or below, or let's say, the belly button. In the case of saying that a knee injury is below the head, that's of course pretty stupid. However, if you have, let's say, a facial laceration, right? You're cut in the face and you have to explain where that cut is. You could say, well, the cut is on the left-hand side and it's inferior to the nose. So it's below the nose. That's how that works, okay? What else? Anterior or posterior. Now, anterior or posterior is more related to the front or back. Now, anterior means in front and posterior means in the back. And other terms used for the same thing are anterior or ventral and posterior or dorsal. And you can think about a dorsal fin on a dolphin to remember that dorsal is back, okay? But for now, we'll go with posterior and anterior. So posterior being more to the back, anterior being more to the front. And again, these terms are used to identify the location of a certain organ or spot or wound or whatever that may be, right? So you could say the sternum, again, the breastbone, right, is anterior to the spine. Or vice versa, you could say the spine is posterior to the sternum. And that way you indicate whether it's to the front or to the back, right? Okay, what else? Well, we have proximal and distal, and this is used all the time in TV shows. Now, this is only used for extremities, so legs and arms. If you have a wound on an arm, you need to explain where the wound is located, okay? Now, proximal means closer to where the extremity originates. So if it's closer to the shoulder, you could say the wound is proximal to the elbow, right? So it's further, or it's closer to the shoulder compared to the position of the elbow. You could say, well, it's distal to the elbow, so it would be between the elbow and the hand. That's how that works, okay? What else? Well, this one is a bit easier to understand. Superficial versus deep. If you have a superficial cut, it's close to the skin. If you have a deep wound, it's further away from the skin, and in this case, deeper inside the body, all right? All right, how about unilateral and bilateral? Unilateral means on one side of the body. So the patient has second-degree burns unilateral, right, on the left-hand side, for example. So it's on one side of the body. Has second-degree burns bilaterally, so both sides of the body. And then you can also add anterior or posterior, so in the front or in the back and that kind of thing, yeah? Let's see what else. And this is one that I had to look up because this is something that I really don't use myself, but it's interesting to know. And it's called ipsilateral or contralateral, right? Now, let's say you have ipsilateral wounds. Well, that means that it's all on one side of the body. And I talked about unilateral and bilateral just now, but they do this to indicate that if you have wounds on your left arm and on your right leg, that will be contralateral. Lateral meaning one side, contra meaning not on one side, okay? So yeah, these are the terms that are used all the time. I'll obviously have a lot of illustrations to help you understand better, and hopefully this will help you to communicate better if you got something going on where you need to provide medical care, right? That's it for this video. Thank you guys so much for watching. See you in the next one. Bye.